I don't know how many of you have had the opportunity to look at the posters and as you stay for the poster session, but they are extraordinary. And the example that Maggie, Mark, and Kate brought to us is reflected in all the work that is being done across the Commonwealth of Massachusetts. And I want to thank those practitioners and fellows in our first 2 years for the extraordinary work that sets an example nationwide. You have no idea what the impact is on the work that's being done here, as we, Massachusetts, are the laboratory for the nation. So I want to thank you on behalf of all of our colleagues here in Massachusetts, our community health centers, 50 community health center corporations, 280 practice sites serving over 850,000 people in Massachusetts, and moving through the ACA to serve over 23 million people across these United States of America. I want to thank Paul for the impact he's made on all of us, not only in his work in global health, but the example and the vision he sets for doing more for people in the place where they are. And that's another connection to community health centers. Not having people come to us, but to have us go to them. And for finding that time through the Kraft program to step back, as Paul said, to reflect for a moment, to plan going forward, to have that protected time, to in fact lead through example and through these innovative projects. So it's really incredible on your work, Paul, and we're all ready to go. Our bags are packed. Let us know where the next stop is on this moving train of inspiration and vision. Thank you to the Kraft family. This is an extraordinary gift. Make no mistake about it. When we went to Mr. Kraft's home to receive the news that we were going to be awarded this very large gift from the Kraft family, and after Derry and Gary had called and said Matt Fishman would like to join with the community health centers and provide inspiration for this program, it was extraordinary in that we usually are not in places where the philanthropists are. We are usually not in places where the big corporations are. And in fact, until these partnerships have evolved between academic medicine and community health centers, which have evolved beautifully, we were never in those places either. And so what has occurred is a transforming nexus between community health, public health, and the philanthropy and leadership that can bring great vision and great, if you will, attention to our cause of community-based health care. The Kraft Center in particular, in its leadership by Derry and her team, in combination with Joan Panisse and my team at the League, is a game changer. Let's make no mistake about that. Not a baseball or football metaphor, but in fact a metaphor that politically resonates with policymakers and those that can leverage resources to help our work, not only here in Massachusetts, but nationwide. We don't have Partners Healthcare in rural Mound Bayou, Mississippi to provide this kind of leadership. But we have the Kraft Center and Partners Healthcare and the League of Community Health Centers joining together to provide example of what can work with local philanthropy, with leveraging dollars between government and payers and community-based providers, and the impact it can make. And it's in these posters, it's in the work that our health centers do, and in this enabling of us to be able to recruit and retain the best quality practitioners, the best quality teams, the healthcare workers, the CACs, the community healthcare workers and health educators that basically can make an impact on people's lives. It is a game changer, and I thank you all for your support of these efforts, and in particular, my health center colleagues. To recruit, enable, and retain what our patients need and what our patients deserve is what this is all about on the ground. This is work on the ground. This is showing examples, new and old, coming together. Staid community health practitioners, newbies coming in, providing guidance and light and vision. This is what it's all about, maximizing community health centers. So we know that the work is ongoing, and we know that, that in fact we have a lot more work to do, not only here in Massachusetts, but across this country. We've been privileged through Derry's leadership and with the support of the practitioners and fellows to go to Washington, to do capstones, to do interventions, to begin to take this cohort of new leadership that we have and connect it with other leaders across the country. And my hope and dream and vision is that will continue not only in this country but possibly globally going forward.